This webinar has been designed to provide an introduction to workforce planning in primary care and an overview of an approach to workforce planning that you might find useful. Firstly, I'd like to run through the format of the webinar. The webinar will last for about 40 minutes in total. It has been designed so that you can come back and review the presentation at a later date. The webinar is supported by a number of resources, including the Workforce Planning Template and Guidance that will lead you through workforce planning in your practice or cluster. This webinar is the first part of a number of resources that are being developed to help you plan your workforce, not only within your practice but across the cluster. It will provide you with an overview of the population-based workforce planning approach for primary care in Wales. We will be exploring why workforce planning is important for primary care and why we need to think about it. What workforce planning actually is, as there is much talk about workforce planning now, and it would be useful to think about what we mean when we talk about it. Why we developed a workforce planning approach for use in primary care, and what the approach is, and how you can use it to help you plan for the workforce roles and skills you need in primary care. There have been a number of strategies and plans for the NHS over the past decade, including a number specifically for primary care. A planned primary care workforce sets out the plan for primary care in Wales, with a number of actions, including putting in place the foundations for a more robust approach to workforce planning. As part of this plan, which ran between 2015 and 2018, a number of pace-setter projects were initiated, and these have led to a new and emerging workforce model for primary care. A Healthier Wales has continued to set the direction for Wales with renewed emphasis on the shift of services from acute and hospital to more focus on prevention and keeping people well, and with more access to services provided closer to home, in the community and primary care, by multidisciplinary and multi-professional teams. This will be supported by the Workforce Strategy for Health and Social Care, which I'll refer to shortly. In 2018, the National Strategic Programme for Primary Care was launched. This programme encompasses 6 national work streams, one of which focuses on the primary care workforce and includes building workforce planning skills and knowledge. There's a handy booklet on the strategic programme, which is available from the Primary One website. There are many things happening now that are driving the need for better workforce planning and for us to think about the sort of workforce, roles and skills we're going to need in the future. Our population is ageing, and this is having a greater impact in rural areas, where in some cases the population is also shrinking. The increase in population age is leading to increased demand, especially in primary care, where a larger population of older people with comorbidities are needing to access primary care and community-based services. As our population ages, so does our workforce, as we tend to draw them from our local communities. In some areas of Wales, there is a falling supply of younger people, or people with the right education and skills. We also currently have a bubble of upcoming retirements of experienced staff, and in some areas difficulty in sourcing replacements. There are other issues impacting on our workforce, for example pension changes, different employment behaviours, aspiration and changes to the way we do and will work due to advancements in digital and medical technologies. Primary care is changing too, with new approaches to care delivery. There's a greater need to work collaboratively, with greater flexibility and at scale, so that we're able to benefit from multidisciplinary and shared working approaches. This means that workforce planning at cluster level is becoming an important way for us to be able to secure a sustainable workforce, prepare for the future changes and explore innovative workforce opportunities. Cluster plans have been in existence for some time now. Welsh Government now require clusters to develop integrated medium-term plans in line with the expectation of health boards and trusts. The planning guidance indicates that there will be a requirement for more information with regards to future workforce requirements in subsequent iterations of the cluster IMTPs. The introduction and rollout of Wales National Workforce Reporting System enables practices and clusters to have better access to and knowledge of their current workforce information, such as age profiles, roles and working patterns. This improved and easier access to workforce data across a number of areas will make workforce planning easier. With the shift of services towards community settings, we need to plan local services and better access to those local services. Workforce planning helps to drive service change, to improve patient experience, and how that can be driven by planning for what the local population needs are. These principles are really useful when we're thinking about the workforce we need. They help us to focus on what our patients and local population need and want from the NHS. They're helpful to change the way we think about workforce planning, moving from planning the workforce based on what we've traditionally done toward being brave and bold and thinking differently about what we might actually need that's different. They help to focus thinking on who is the right worker to deliver care at different points in time, what tasks need to be done and by what type of role or worker, what care should be delivered by different roles or workers, and are there opportunities to extend workers' scope of practice? There is also a specific workforce principle. Only do what only you can do. This principle asks us to think about working at the top of our licence. That means providing the service at the value of the skills and knowledge we hold and moving those tasks we should no longer be doing to another appropriately trained and competent member of the team. We've been doing this for a while, but maybe without realising it or actively planning for it. The workforce strategy was one of the key recommendations from A Healthier Wales. The strategy will be launched in 2020 and will set the vision for what we need to do to make sure we have a motivated, engaged and valued health and social care workforce with the capacity, capability and confidence to meet the needs of the people of Wales. The strategy focuses on 7 key themes, which are supported by a number of actions. More detailed support and implementation plans will be developed to support the delivery of these actions. Our workforce is our greatest asset, and without it we cannot provide the care for the population of Wales. There are golden threads running through the workforce strategy, including the Welsh language and how we support the development of a bilingual workforce, how we can ensure that what we do is inclusive and embraces and supports the diversity of our workforce, and how we create the culture to support and drive the changes we need to make. NHS Wales is working on a consistent approach to leadership and to embed a culture of compassionate leadership across both health and social care. The aim of workforce planning is to ensure that you have a workforce of the right size, with the right skills and diversity organised in the right way, within an affordable budget that can deliver the services needed to provide patient care to the required quality standards. Your workforce needs to be the right shape and size to manage the workload of the practice and cluster in the short term, while flexible enough to cope with a range of future changes. Developing a cluster workforce plan has many benefits. It will ensure that you have a supply of workforce with the skills to meet your cluster's population health needs. It will enable you to develop enhanced working relations with partners across the cluster. And it'll help you to identify the opportunities for joint workforce solutions, including cross-professional or cross-boundary working. Workforce planning also involves understanding the impact of changes on your current and future workforce across the cluster. How do planned changes in your practice impact on the cluster or even the health board? Identifying what skills and competencies you will need to deliver your future services and where will these come from? Can you develop your current staff or support the development of new staff or trainees? What leadership is required to make sure staff are engaged in any change and new ways of working and development plans are delivered? In essence, workforce planning is a balance between 3 elements: need, demand and supply. Planning for the workforce you need to meet the demand for your services. Identifying where the workforce will come from and what it is that you need to do to develop it, and finally, what that workforce would cost and whether it is actually affordable. We look at these in more detail as I go through the workforce planning approach. The need of the workforce comes from the consideration of future population and health needs. The demand for the workforce comes from the types of patients that we see now and their current needs. And the supply of the workforce is impacted on by a number of issues like the training pipeline and the local availability of skills and even population trends. The Directors of Primary and Community Care commissioned a piece of work to develop a workforce planning approach for use in primary care. Workforce Education and Development Services, WEDS, a predecessor of HEIW, were asked to undertake this work and contracted with Scales for Health. The North and South clusters in Cwm Taf Morgannwg Health Board volunteered to help us to develop a population health-focused workforce planning approach that could be used by practices and clusters. The approach was developed as a set of templates and resources for practice and clusters to use. Based on the 6-step methodology used widely across the NHS, the approach breaks workforce planning down further into 4 questions. The approach includes a workforce planning template, supporting guidance and a resource to help you to analyse your workforce data from the Wales National Workforce Reporting System. The Cynon clusters also developed a set of principles for workforce planning at cluster level. These emerged as they progressed through the work to develop the approach. The first 2 principles are possibly the most important. To effectively workforce plan at cluster level, collaboration will be essential. In fact, the 2 clusters who helped us to develop this approach found that developing the workforce plan was a great focus for collaboration across the clusters. Planning to create a sustainable workforce should also be at the heart of every workforce plan, as the workforce and their skills are the greatest asset we have. The approach is designed as a thinking process for people to go through as they create their cluster workforce plans. It is based on the 4 key questions you might ask yourself when thinking about your workforce needs. To answer each of these questions, you need to undertake some activities. We will look at each of these questions and activities in turn. If you are developing a cluster-level workforce plan, it is advisable that a representative from each practice within the cluster be part of a workforce plan development group to ensure all cluster practices are involved in discussions and are signed up to the plan and its implementation. It's important to do some thinking at the start of developing your plan. Why are you creating a workforce plan? And who should be involved? What are you looking at or considering? For example, are you planning for a service you want to introduce or for the workforce across a cluster? And is the plan being driven by a strategy? And how will the workforce plan address this? Doing this thinking could be part of discussions you're having with colleagues about certain issues that are impacting on your workforce now. And it's these discussions and thinking that can help you to decide if you need a workforce plan and what it will cover. This involves thinking about and understanding your current state. To help you to do this, you'll need to undertake 4 activities. Your stakeholders, who are they? For this plan, who do you need to engage with and talk with to make sure that there is ownership of the plan? Who needs to be involved from within your practice, cluster and possibly health board? Are there any external people you need to speak to or engage with? It's useful to spend more time thinking of these people and make a list. Your future need for workforce comes from issues such as your local population health needs, so it is essential for you to understand your population profile and its health needs. For example, is there a large proportion of your local population who are likely to be aged over 80 within the next 5 to 10 years? Is it likely that demand for dementia services is going to increase with the ageing of your local population? And do you currently have the workforce skills and knowledge to meet this increase in demand? What is the current demand for services within the cluster? What data do you have access to? And what does it tell you about the types of patients using your services currently? Do you currently have the right workforce to meet this demand? Has your workforce got all the right skills and knowledge to meet current services? Have there been any changes in demand recently? For example, an increase in patients presenting with stress and anxiety? Or are there any seasonal peaks? What does your current workforce look like at practice and cluster level? What types of staff do you have? How many of each role? What are their skills and competence? You will have to access workforce data, and you can get this from the New Wales National Workforce Reporting System. This workforce planning approach includes resources to help you to analyse your current workforce. Data is important for workforce planning. We tend to have a lot of data, however. It is not always easily accessible or provided in a way that gives us the information we need. That said, access to data is improving, and it is worthwhile considering what data or information you need, if you or someone else has access to it, and how you will use it to inform your workforce plan. Workforce planning isn't just about numbers. It's a thinking, talking and analysing process that helps you to identify the real gaps and make plans for how to address these to achieve the future workforce you have identified that you require to meet service needs. Having identified all those who need to be involved in the development of your cluster plan, and having gathered and analysed a lot of information, you will have identified a picture of where your practice and the cluster is now, and what's driving any need for change. You now need to create a shared vision for where you want your future workforce to be. Your discussions and analysis will have helped you to identify and agree what your future workforce requirements are. There are some tools to help you at this point, including a SWOT and PESTLE, and these can be accessed online. The links to where you can find these tools is within the Supporting Tools and Resources document. These are quite simple tools, and you can choose to use them if you personally find them useful. At this point, you will have done a lot of thinking, talking to people, analysis and working together, and you will be ready to develop your plan for the way forward and for what you need to do for your workforce. All this will help you to ascertain where your workforce comes from and is there enough supply. Where your workforce comes from will be different for different roles, and especially where the training required is at different levels. For example, GPs, nursing, AHPs and pharmacists are degree and postgraduate qualified staff who are trained based on information supplied via the Health Board's IMTPs. There are long training pipelines for these staff, although some supply is available always via the jobs market. Other staff, such as healthcare support workers and administrative staff, typically are recruited from the local population and are trained within the workplace. Understanding where your workforce comes from is an important consideration. You'll need to know what that recruitment market is like, and you're looking further into the future where training and new skills will be required. Consider what you need to do to make sure that these people will be trained and available, and how long will it be before they are available. An example of this would be the recent development of the training routes of the physician associate. What your workforce challenges and gaps are, well, you will need to identify these in your plan so that you can identify the actions you need to take to address these gaps. There are some final things to think about. Could your new workforce shape help to improve recruitment and retention, particularly in terms of attractive career, learning and development opportunities? Or do you need to transform or change your workforce as a result of what you have found out from speaking with stakeholders or what the data is telling you? People often refer to workforce transformation, but what does that actually mean? Transformation is about positive change, so we are able to develop our workforce and be ready to be able to meet the future need. Transformation takes time, as some of the changes you need to make to your workforce may require external changes, such as to training schemes. We need to transform to be able to make improvements to service delivery, because technological changes may drive and enable changes to how, when and where we deliver the service. To take advantage of advancements in knowledge, medical practice and treatments, and so we can change and adapt our workforce to make better use of their skills and knowledge and maintain services to our population. The workforce model in primary care is already transforming in response to a range of changes to health and patient need, new ways of working and technological changes. This slide shows a representation of the emerging workforce model for primary care. It illustrates how the workforce model has already changed following lots of work undertaken by the Pacesetter project. It is also showing how your practice and cluster's workforce sits within a wider system, where other parts of the workforce contribute to the delivery of the community health service. This model is helpful when considering your future planned workforce changes within this whole context. Having done all this work, you will now be able to create and prioritise your action plan. What needs to be done, by who and when. All the work, thinking and talking you will have done up to this point will enable you to create an action plan that takes into consideration your workforce challenges, gaps between supply and demand, and the changes that you have identified that you need to make and by when. This plan is flexible, and you will need to review and adapt it regularly. It needs to be affordable, achievable and realistic. It's worth remembering at this point that the first time you do any planning, it seems daunting and a great deal of work. This is a normal feeling, but once you have been through this process once, for future plans, you will be building on all this knowledge and experience and further developing your plan. The support available will be different across the clusters and health boards. You need to find out whether there is a lead for workforce planning in your cluster, or if there is a health board workforce business partner who supports primary care. There are, however, an increasing amount of online resources and plans to offer more in-depth training if there is a demand. This resource gives you more background information on workforce planning. This live resource contains useful information on roles, what they are, what they contribute to the multidisciplinary team, and contains useful information and examples of job descriptions. This resource is often being added to as people share more examples. This resource has recently been updated and provides information on when and how to safely delegate, a really useful resource if you are changing workforce structures and who is doing what work. There is also a cluster handbook which contains some basic information on workforce planning in primary care. These resources and others you might find useful are available via the HEIW website and Primary One. More resources will become available over time, so it would be useful to keep checking these sites and watch out for communications.